I'm Elizabeth Vargas.
And I'm John Stossel.
And this is 2020.
Welcome to 2020. This next clip is about Medicare. What is Medicare? Who's in charge of it? Who's entitled? And how does the government fund it all? And what exactly is Medicare? Medicare is a social insurance program administered by the United States government, which provides health insurance coverage to senior citizens or U.S. citizens who meet other special criteria. It was originally signed into law on July 30th, 1965 by President Lyndon B. Johnson as an amendment to the Social Security legislation. At the bill's signing ceremony, President Johnson enrolled former President Harry S. Truman as the first Medicare beneficiary and presented him with the first Medicare card. Originally, Medicare was established to provide health care services to the elderly, low-income children deprived of parental support, their caretaker relatives, the blind, and individuals with disabilities. Seniors were the population group most likely to be living in poverty, and at the time, only 50% had health insurance coverage. But what about now?
Yeah, yes.
And how do you feel about your current Medicare situation?
Okay.
You feel good about it?
Yeah, at this time it's okay.
Mm-hmm.
It's okay for me, but I don't know how it's going to be on down the line for those after me, younger than me and you.
So like the baby boom generation?
Uh-huh, right.
What do you think is going to happen?
If the economy doesn't change, it's not going to be here. You know, it just, you know, there's not going to be anything for you guys. You know, if the people don't start realizing that, that we can't have everything in the world that we want. You know, everybody right now thinks that they need what the Joneses have next door. They need, you know, they need cars and boats and all this stuff. And so if, and that does keep the economy going. But the other thing is that people are, how many jobs are you going to have to work at in order to pay for all these things?
But who decides who gets to use the system? Let's see what Richard S. Foster, Chief Actuary of the Centers of Medicare, has to say. What exactly do you do, Mr. Foster, as Chief Actuary?
Well, John, my main job is to provide accounting information and cost projections to the Medicare Board of Trustees in order to assist them in assessing the financial health of the program. Also, we work closely with the Social Security Administration in determining Medicare eligibility and processing premium payments for the Medicare program.
I see. When determining eligibility, what are some things that you consider?
Well, first of all, John, everyone must either be a U.S. citizen or a legal resident of 5 continuous years. After that, it comes down to age and need. Any healthy individual becomes eligible at age 65. Otherwise, they must be disabled or have been receiving either Social Security or the Railroad Retirement Board disability benefits for at least 24 months. Or they can get a continuing dialysis for end-stage renal disease or need a kidney transplant. Or they're eligible for Social Security disability insurance and have Lou Gehrig's disease.
It's odd he left out all the politicians who reap the benefits of Medicare and our tax dollars every day. Give me a break! Few would disagree that a healthcare crisis looms large in the U.S. In a country with millions of uninsured and underinsured citizens, healthcare has become more of a privilege than a right. Indeed, the United States remains the only industrialized country in the world that doesn't guarantee healthcare to all its citizens. But this isn't the case for members of U.S. Congress. Representatives and senators alike receive some of the best healthcare benefits in the country, much of it paid for with taxpayer dollars. Yet these same members seem unable, or unwilling, to extend similar protection to the rest of America. Congresswoman Smith, do you have a second? for an interview. I'd like to ask you a couple questions.
I'm actually on my way to a conference right now, but
I mean, I can follow you in there and just wait. It's pretty...
yeah, sure. Come on.
John Smith, as you may well know, the United States is one of the only modern countries that doesn't guarantee health care to all its citizens. Some say that the reason behind this is that the cost would be too high. Can you explain that to us?
Well, American healthcare is far superior to what other countries offer, and therefore is more expensive. But only providing healthcare for those who are in need and incapable of obtaining it in any other way, we save money.
So, are you telling me that we are saving money by providing healthcare for U.S. Congress members who aren't eligible?
Technically, most U.S. citizens receive healthcare through their employer. For Congress members, it's the same way.
But isn't it true that most people still have to pay some portion for either their own health care or Medicare for others through their tax dollars? And isn't it also true that some of these said tax dollars allow Congress members to receive some of the best benefits in the country?
Well, that isn't always the case.
Using Congresswoman Smith as an example, we now see that Congress members who aren't eligible are receiving Medicare. How can the government afford to provide Medicare for those who are eligible and Congress members who are not? Just how much money is being spent?
You see, John, for the 2007 fiscal year, total Medicare spending reached $440 billion, or 16% of all federal spending. The only larger categories were Social Security and Defense. Given the current pattern of spending growth, maintaining Medicare's financing over the long term may well require significant changes. According to the 2008 report by the Board of Trustees for Medicare and Social Security, Medicare will spend more than it brings in from taxes this year.
As director of the Congressional Budget Office, Roberta Sunshine knows what she is talking about. The CBO also projects that total federal Medicare and Medicaid outlays will rise from 4% of the GDP in 2007 to 12% in 2015 and 19% in 2082, which, as a share of the economy, is roughly equivalent to the total amount that federal government spends today. The bulk of that projected increase is healthcare spending reflects higher cost per beneficiary rather than an increase in the number of beneficiaries associated with an aging population. So what needs to change? The specialists are still looking for a solution to the healthcare crisis.